there are two or three things that I really want you to get out of today's discussion. A better understanding, or I would say a deeper understanding of what's triggering those genes of inflammation and arthritis. What's upregulating the expression of those genes of autoimmunity? What are some of the strategies, some of the natural solutions that you can offer to your patients? Just as a general overview, rheumatoid arthritis, we know that it's an autoimmune condition that mostly targets and affects the lining of the joints. It could eventually lead to destruction of other tissues in our body. It is an autoimmune condition in which the immune system mistakenly targets the healthy cells of the joints. It's a very common condition. It's according to the CDC, there's over 1.3 million people worldwide that are impacted by this specific condition. And it can start at any age, but it's most commonly between the age of 30 to 50 to get a diagnosis. And according to Johns Hopkins Arthritis Center, the prevalence increases with age. There are multiple challenges with working with patients with rheumatoid arthritis. Many of those patients keep progressing and get worse and worse, despite the fact that they're taking those medications. We've all seen those patients in our offices. One of the patients that came to see us once, she was on multiple types of medication, and she was losing her ability to even bend her fingers, right, to flex her fingers, which was at some point she couldn't even hold a cup of tea or water properly, right? It's a terrible, terrible condition. In functional medicine, of course, we focus on understanding why the patient developed the disease and what needs to be done to start restoring healthier function.
Yeah, absolutely. And actually, in the beginning of my career and when I first started practice, I was in pain management. So I saw a lot of patients who had for rheumatology, right? Whether it be osteoarthritis or rheumatoid arthritis. And the biggest thing with that is that in functional medicine, we can give them hope within these conditions. As you were saying, a lot of patients feel hopeless because they're going from doctor to doctor. They're on so many medications. They're not feeling better. Their health keeps decreasing. And so when they come to a practitioner who actually has some tools to be able to utilize and help them, it gives them hope. And then they start to see the improvements. And this is kind of like why I love functional medicine is to not only give patients hope, but also to give them tools and options to actually start to improve their health for them. This is from the European Journal of Rheumatology. We can see on the left-hand side and on the bottom there, right, you're going to see at-risk individuals and then RA individuals, right? They're going to go into what's considered stage 1. This is what occurs when there's a predisposition and exposure to environmental risk factors, which we will get into, that is going to begin to trigger an immune response. So if you have a patient and they have a family history, right? You look at their intake, they have a family history of rheumatoid arthritis, you want to take a look at their risk factors and monitor this for them so you can help to prevent this from progressing. Now, the next stage is stage 2. This is when autoantibodies of RA are present, like rheumatoid factor or anti-CCP. This is the marker that is present in blood testing. Anti-CCP, CCP just stands for anti-cyclic citrullinated peptides. This is what you're looking for when you are doing blood testing. Let's say you have a patient who has a family history and they're concerned that they might progress into RA. You can run some tests on them. And what you would want to run is rheumatoid factor, anti-CCP. Those are a couple of markers. There's going to be other markers that are also indicated for them. Now let's go into stage 3. This is what occurs when symptoms like joint pain or stiffness are present, but there is no other clinical evidence of arthritis. This means that by the time a patient comes to see you and they're in stage 3 with chronic pain due to RA, they've already had immune dysfunction and overactivation for weeks or months, and they've already been developing antibodies for a while. So this is important to understand when they're at this point. We want to look at a different type of approach for them. And that's what we'll kind of dive into a little bit more. Stage 4. Now, this is when there is clinical evidence of arthritis in one or two joints, and this is considered an early undifferentiated arthritis. If these symptoms are intermittent, it's going to be called palindromic rheumatism. And that is important to understand that that occurs within stage 4. And then stage 5 happens when the individual meets all the diagnostic criteria established with RA. And that is all of the stages that we want to consider when you're working with patients who may be at risk for rheumatoid arthritis or already have rheumatoid arthritis. You want to figure out what stage they're in, and you could do that through their intake and through lab work as well. So as I was mentioning, there are risk factors to consider for rheumatoid arthritis. So we want to discuss a few of those risk factors here. In this image, this is going to show a number of environmental risk factors, and these all clearly contribute to rheumatoid arthritis susceptibility. This includes smoking, infections, periodontitis, obesity, and hormonal and dietary factors. These are all factors that we can look at improving for them, except for the dental procedures. Obviously, you're going to be referring them to a dentist for that. But things like smoking, infections, obesity, hormonal, and dietary factors, these are all risk factors that we can help our patients in improving for them. As I was saying, let's say they were in stage 1 or even in stage 2, and they have a family history of rheumatoid arthritis, and they have some of these risk factors. You would want to look at decreasing some of these risk factors for them and improving on some of these issues for them to help prevent the disease progression for them.
Patients come to see us and they have certain expectations of resolving this as soon as possible. We definitely had a lot of those patients that would come in and, they hear something good about you as a practitioner, and they want to see if can you resolve this in they expect it to feel better within a couple of months, right?
Right.
And one of the things that we always tell patients is that the expectations, everything has to be set up in advance, because that helps us to make sure that we're capable of fulfilling what the patient is looking for, and also set up the expectation that they might have this pain started like last month or 2 months ago, but chronic inflammation has been there for quite a while. It could have been there for a few months, could have been there for a few years, right? And then the symptoms started to increase slowly to the point when they're like, oh, now I'm actually noticing this every day, that swollen fingers or that, right? So it's important to set up proper expectation with patient, explaining them that it's going to take time. It took probably 2, 3, 5, 10 years to develop this disease. It's probably going to take time, anywhere between 6 months to a year to see really good results. We got multiple strategies I'm going to talk about that can together get them there faster, right? But it's good to know the stages and how to explain that to a patient. Let's dive into the first trigger of functional medicine. Dr. Chile already mentioned about the environmental factors. And so we're going to dive into RA trigger number 1, which is air pollutants. So air pollutants is quite a big topic. We got probably about a few hours of presentation about the different lab testing and different biomarkers and how to identify which group of pollutants and the detox process. So it's quite more complex than what we're going to show it today. What's important to remember is that when we breathe in air pollutants, or we consume them through food, or we consume chemicals through food and water, it triggers an inflammatory reaction. And air pollutant specifically can lead to dysregulation of both the innate and adaptive immune system. So we're going to take a look at this picture. from an established published study in the Journal of Environmental Pollution in 2023. On the top, you can see that the term air pollutant or environmental factors refer to a mixture of gases and particles that are mostly generated by human activities, such as smoking, cars, industry, different types of industries, and agriculture. I'll give you an example. If you live in a city, we're all exposed to car emissions. We're exposed to dust. A lot of those particles are in the air and dust. And another example is there was a glass factory here in Portland that had a cease and desist a few years ago by the governor because they found that it was polluting the entire area in Portland all around the factory, right? So those particles are all around us in the air. We breathe them in, and that leads to, as we breathe them and they come into our circulation, they get into our circulation, our immune system travels and in our body and encounters those foreign particles, right? At that point, the immune system is simply, in simple terms, says, I don't recognize this particle, and start the immune process. Now, I'm oversimplifying it, of course, because there's other mechanisms that determine if the immune system will shut down at some point or will carry on this ongoing and aggressive activity against certain tissues, in this case, rheumatoid arthritis, against our joints. And we know that there's genetic factors, so some individuals have the predisposition for this condition. There's also the topic of nutritional deficiencies. So, for example, patients that have vitamin D deficiency, they're not, let's say, not exposed to sunlight enough, or they don't get that enough in their food, then they have even higher susceptibility to developing an ongoing chronic subclinical systemic inflammation that eventually what leads to is two things. One is on the right side, on the center. In the center, you can see the development of autoantibodies, such as the anti-citrullinated protein antibodies and rheumatoid factor. When we have inflammation, we also have reactive oxygen species, right? The ROS that you see there in that orange mark. Reactive oxygen species are essentially different types of free radicals that cause damage to our tissues. And then, of course, that leads to the more oxidative stress you have, the more reactive oxygen species you have, the more damage you have, more immune cells are sent to the area of damage, the inflammation increases, right? So that's almost like a vicious cycle that kind of, you can see the release of cytokines leads to an increase of inflammatory cells, that leads to rheumatoid factors, right? And the increase of inflammatory cells also increase the release of cytokines or chemokines, such as interleukin-6, which also plays a role in destroying our joints. And that, again, leads to a higher increase of reactive oxygen species. Of course, we're oversimplifying this, and there's several reasons why the joints are being affected, right? When it comes to environmental medicine, it's a very, very big topic. Understand all the factors in our environment that can contribute to that rheumatoid factor, the development of antibodies, the development of those inflammatory cytokines. Learn what are the specific signs and symptoms, and also learn about the treatment strategies and the lab specific biomarkers, which we do because we're focused heavily in our program on the clinical application. There's multiple strategies how to reduce environmental exposure. You can have a HEPA filter. That's an HEPA filter. That's a filter that essentially circulates air through a certain three-phase filter that clears a lot of those particles. There's some interesting studies and reports that show that with running a HEPA filter, you can significantly reduce the exposure to air particles, air pollutions. And then, of course, if your patient works in construction, in a metal factory, any type of occupation that could expose them to more of those air pollutants, then it's important to make sure that they take appropriate precaution. So this reminds me, I had a patient once that had a lot of joint pain. Her physician thought that she's got arthritis. Her labs did not match exactly the clinical presentation of rheumatoid arthritis, but it was definitely, that presentation was definitely there. She had bilateral swelling and pain and all that stuff, and came to see me. She was quite frustrated. She was taking different types of medication, and she was quite frustrated. And I asked her, what do you do what do you do for a living? And she said, I work in a nail salon. And it was really interesting because I started to suspect that all those chemicals that she's breathing in the nail salon and the hairsprayers that they're using in that salon could be impacting her health. So we did some lab testing. We looked at different markers. We supported her where we needed to support her. And then the real breakthrough came in when she went out on vacation away from the salon. She went out and she spent some time with family, and then she spent some time at home during the holiday. Her pain significantly reduced while she was still on the same protocols. So this is just an example of understanding that using drugs or using supplements or using natural solutions instead of drugs, we have to understand what's driving the patient's disease or contributing to it. Because if we don't, they keep stimulating that, they keep flaring up that situation, right? It's just counterproductive. Within the first few days of not being at work at all, she started feeling so much better. Like just on the fifth or sixth day of not being at work, exposed to all of these hairsprays, nail chemicals, all of that stuff, while being on the anti-inflammatory protocols, she started feeling better. And it was significant. Like she came to see me 3 weeks later. It was quite a significant change. So all of this work went way better when we understand the root cause. Dr. Chill, take us into the second factor, which is also very, very important, and we talk about quite often.
Yeah, absolutely. So if you have been listening to us and been with us every week and listening to these podcasts, you know how important the microbiome is to overall health, and is no different with rheumatology and our joint health, because this is a major contributing factor to rheumatoid arthritis, is changes in the gut microbiome. We all know now that it is a chronic autoimmune condition, right? This is going to primarily affect your joints. And then there are microbial infections that is considered a crucial inducer of rheumatoid arthritis. There's numerous studies that are highlighting a critical role of the gut microbiome and the health of the gut microbiome and rheumatoid arthritis. What this means is that when there is an imbalance of the gut microbiome, whether it be with a deficiency of healthy or beneficial microbes versus an overgrowth of microbes, this can lead to a pathogenesis, and it mainly produces pro-inflammatory metabolites. It impairs intestinal mucosal barrier, and then it can cause molecular mimicry of autoantigens. And this is what can cause the pathogenesis of an autoimmune condition. Okay, so this is a very complex image. So I want to break this all down for you. This is showing the gut microbiota and the pathogenesis of RA, or rheumatoid arthritis, and the effects of RA, including therapeutic drugs and the gut microbiota. So we can see here in section A on the top left there, this is going to show that there are changes in the composition of the gut microbiome, and this occurs at different stages of RA. This is another important factor why we went through the different stages of RA. What happens is levels of Prevotella and lactobacillus are increased, and this can happen at the early stage, and then an abundance of lactobacillus, Collinsella, and Akkermansia is increased, while that Haemophilus species decrease, and this all occurs in the active RA phase. So we understand that there are certain microbes that are beneficial for preventing RA, and then there are microbes when they are decreased, such as the Akkermansia and Haemophilus and the lactobacillus. This can be this can be shown to be activating in RA. Now, in section B, this is going to go into RA treatment drugs, which can improve gut microbiome imbalances. And this can actually relieve the symptoms of RA. This includes methotrexate, which we see right there, and others. This also includes traditional Chinese medicine. And this has been shown that when these medications improve the gut microbiota, some of the symptoms of RA will improve. Now let's go into section C on the right-hand side there. Here we can see how autoimmunity is activated. So the gut microbiome, this can lead to damage of the epithelium and to the opening of the paracellular pathway. And this can cross the epithelium and get in contact with the immune cells. This all happens beneath the epithelial layer, and this can lead to inflammation. What happens here is bacterial antigens will promote an activation of autoreactive immune cells. This is your B cells and your T cells. This all occurs in your lymphoid tissue. This results in an imbalance of regulatory T cells and T helper 17 cells. This all causes an expansion of an inflammatory response, which activates B cells to produce autoantibodies, right? This is your anti-CP antibody that we were mentioning earlier, and the rheumatoid factor that we were mentioning earlier. And these are some of the markers that we test for. So now let's take a look at section D and how the imbalance of a gut microbiota can trigger the migration of autoreactive cells. This migration of those autoimmune cells, this is what goes into the joints. This is what can cause cartilage and bone damage. This is when you start to have the severe symptoms associated with RA. And how does this all occur, right? So one, the bacterial antigens will trigger and promote inflammation in the synovial membrane. This attracts the leukocytes into the tissue. We see that on the bottom left picture there. Two, there's autoreactive cells. These are going to activate macrophages, and this results in inflammatory cytokine production as well. And then three, the cytokines are going to induce fibroblasts. This is going to produce MMPs. MMP stands for matrix metalloproteinases, and then rank L genes, which is receptor activator of nuclear factor kappa B ligands. And these all mediate destruction of the bone and cartilage tissue. And this is what leads to the development of RA for our patients. So this was a pretty complex picture, but this was the progression of everything from the microbiome and how it can trigger the autoimmune response and the cytokines, which goes into the synovial fluid, which leads to the development of RA.
So this is where we're going to redirect into natural solutions. It's really important for all of us to understand what options can we consider for patients who are maybe on medication and they keep struggle. Maybe they're not on medication, they don't want to be on medication, and they got chronic inflammatory presentation. So the first one we want to talk about is very well known compound, which is curcumin. It's the active component of the traditional Indian spice turmeric. And curcumin has been studied for years for its anti-cancer, antioxidant, anti-mutagenic, anti-inflammatory. And it was very specifically for rheumatoid arthritis. There was a study, it was randomized control study, pilot study, that assessed the efficiency of curcumin with active RA patients. And they found that 500 milligrams per day for 8 weeks led to a significant improvement in disease activity score and the American College of Rheumatology score. The dosage they used in the study was 500 milligrams, but we have seen it sometimes with some patients. They'll need 500 milligrams twice a day when they wake up, before they go to sleep, to get a stronger response. Of course, for other conditions, we have seen different dosages and different time length. And this is coming from the Journal of Phytotherapy Research. So you can look into that if you want to read more about the details of the study. And I would also I would typically recommend to have patients on this for at least 4 months to start seeing some real meaningful positive changes. Again, depends on the patient, depends on what other medications they're taking, depends on their unique situation. Dr. Chill, take us into the second compound.
Yeah, so this compound is called ginger. This is another spice or an herb that can be used with a rheumatoid arthritis. And ginger, as some of you may be aware, this has been used in traditional Chinese medicine for some time now, along with Ayurvedic medicine for centuries. It dates back all the way to the 1500s. It's known for its potential support in various aspects of health, including anti-inflammatory, antioxidation, antimicrobial properties. And it's been shown what they did with ginger was they did a study to figure out the effects of ginger on inflammation, in particular for rheumatoid arthritis. And what the results of the study showed was that consumption of 1,500 milligrams for 12 weeks led to a significant reduction in disease activity score and a reduction in inflammatory cytokines. Remember, we were discussing the mechanisms of rheumatoid arthritis, and there's an influx of inflammatory cytokines. So ginger has been shown to help reduce those inflammatory cytokines. And if you want to read more about that, the article is called "The Effect of Ginger Supplementation on Some Immunity and Inflammation Intermediate Genes Expression in Patients with Active RA."
So these a couple of clinical notes that I wanted to mention with those supplements. One, combining those compounds, there are some interesting studies that show that combining those compounds together, many cases could be much more beneficial. Each one of those compounds might have different mechanisms. So for example, when we go through functional immunology, we learn very specifically about what's the mechanisms of each one of those, right? So omega-3 has a completely separate mechanisms of how it reduces inflammation. Ginger, boswellia blocks different enzymes, and curcumin, for example, reduces pro-inflammatory cytokines IL-6 while elevating IL-10, which is anti-inflammatory. It's really helpful when you actually learn about what are the specific mechanisms of each one of those 8 or 9 or 10 different compounds that we teach in the program, because you can fit the right compound to the right patient. So we want to go from just general concepts like we hear of or read or learn here, right? So, oh, you got inflammation, you got RA, great. Here's a couple of good studies. Here's a couple of strategies, curcumin in a specific dosage, and then ginger in a specific dosage. But as you learn more and more the functional and nutritional medicine approach, you want to get more comprehensive and more specialized knowledge in terms of like, let's figure out what works best for you, because customizing and personalizing the treatment strategies based on each individual biochemical needs is always going to work way, way better. I really want to thank all of you for being here, for continuously growing your skills, for investing in yourself, your skills, your patience. And I want to thank Dr. Chill, and take care for now, and we'll see you in the next class.